Hello, Eric. So how have you been?
Or maybe it's
Good? Good. So we're going to, after the initial consult last visit, we're going to perform the extraction of your maxillary molar tooth and also your mandibular premolar tooth today. I would like to know, has there been any updates on your medical history since the last visit? Have you been taking any medications such as like blood thinners or herbal medicines or no? Nothing? Okay, great. So for today's visit, I'm going to extract both teeth, like I said, one from the top arch and the one from the bottom arch. Okay. And I'm going to use local anesthesia for both extractions. I'm going to utilize an inferior alveolar nerve block on the bottom and also a maxillary infiltration for the top. So the possible risks of local anesthesia can involve dizziness or drowsiness, some heart problems possibly, or in very rare instances there may be infection that occurs in the injection sites, but those are very rare instances. And if you're uncomfortable with that, there are other alternatives to local anesthesia, such as nitric oxide. And this is the patient consent form that I would like you to read over. This has all the risks involved in very in detail and all the information that a patient needs to know about the procedure that we're doing today. Could you please read this over and possibly sign this?
Okay.
All right, thank you. So I'm going to take your vital signs now, so we can just make sure that we're good to go. So let me just take your blood pressure. Okay, your blood pressure seems very good. It's 120 over 80, and your pulse also seems like very in the normal range. And your vital signs are all good. Are you feeling anxious in any way, or are you just feeling very nervous about today's visit or today's what we're going to do today? Or is everything good? Okay. All right. So we'll get set up for the extraction.
Okay.
For the extraction of tooth number 22, the second premolar of the mandibular, we will be applying inferior alveolar block. So first, we will be drying the patient's mouth with some gauze, and we'll be using a raspberry flavor topical and apply it near his gum area. And while we're waiting for the topical anesthesia to work, we'll be assembling the carpio. So first, we'll be putting the carpio into a syringe, and I'll make sure that the carpio is properly positioned. I'll be pressing down the thumb ring for a little bit to make sure that the harpoon is properly engaged. Then I'll be screwing in the 27 long gauge onto the thread tip with the cap. And after 5 minutes, I will be injecting the inferior alveolar block to Steven. So please open your mouth. So to properly inject inferior alveolar block, I will have his mouth open, and then I'll be using the retractor to properly expose the injection area. Then I insert the needle, find the pterygal mandibular fissure, and insert the needle into the site for the inferior alveolar block. Upon insertion, I touch the bone and retract the needle for about 1 millimeter. Then I aspirate to make sure that there is no blood coming out. And I would inject about 1/2 of the carpio into the site.
So right now we're gonna do the extraction of your maxillary first molar. So I'm gonna put this topical anesthesia on your buccal fold. So you'll be numb over there. So let me apply it over there. So let's wait for 5 minutes while I'm switching the the head of the needles. So right now we have the short 27 gauge needles for your maxillary and this local anesthesia. So I'm gonna apply this to your apex of your molars, and I want to make sure there's no blood backflow into the gauge. And because it's first molar, so we need to apply also on the middle and the posterior superior alveolar nerve. For that, we will need apply this on the buccal fold adjacent to the maxillary second premolar, and also the PSA side of the high of the buccal fold of the maxillary second molar. So right now we're gonna disassemble this needles. So I will use the scoop technique to put on the cap, and then I will unscrew it and put it into the disposal. And next, I will use a thumb ring to take out the harpoon, and then take out the copule, and then put the copule into the disposal too.